we have, yes, been seen in public. You know, the same ministers, you know, they are not supposed to be doing politics. But we have seen Wamarwa in Western Kenya and elsewhere. In fact, I think he came all the way to Central. We have seen governors who are obviously politically correct, in quotes. You know, these days there are people, members of parliament and MPs, you know, and senators and governors that are politically correct, and others who have been defined or described as politically incorrect. Kuna siasa mbaya yenyewe. So the ministers have started the politics. And therefore, what do you expect from those who do politics? By law, by the constitution? I don't see a problem. I think now we need the masks, if at all the COVID is still there, and we give to people. Myself in Kandara constituency, I gave 63,000 masks, which we made through, which produced in Kandara through the CDF project. So I even the way they have behaved, even HE, himself, even HE, and the other HE, deputy and the head of state, tunaona huko. Hivyo sisi pia sasa naona tuko na ruhusa, lakini tuchunge wananchi. It is important that we ensure that we do not have this problem coming back, and that we can do by ensuring that we still continue keeping social distance, sanitization can continue until we know that we are safe. And I think the period, in fact, of holding Kenyans back by way of regulations or by telling them do not do ABCD is now over. I am of the view that we should now be worried about economic recovery of the country. And even when you are monitoring the curve, you obviously are supposed to take into account the period that you have held people back without full application of their efforts or their energies into the economy. And therefore, for me, by now, incidentally, we should not be having any restrictions. The restrictions should be now applied in this abnormal situation to help us work with COVID-19, if there is any COVID-19 that is remaining. Of course, the numbers are going down, and the numbers have never been correct. For the last 2 months, incidentally, there have not been any reagents. And that's what the Minister for Health is not telling the country. Reagents have not been there, so the testing kits have not been complete, and therefore the numbers that we see may actually not be correct presentation or representation, a correct analysis of the true situation. And this government, you know, has been very careless and reckless. Instead of buying the materials to deal with COVID-19, giving Kenyans food, distributing these materials to the hospitals, ensuring that we have hospital beds where we needed to have, ensuring that we have medicine into the rural areas, and of course the PPEs. We have seen PPEs costing through KEMSA multiplied times 10 times 20 by criminal enterprises